Hi there, I'm Dr. Roy Schwartz, General and Bariatric Surgery with Capital Regional Medical Center. I've been here about 29 years performing surgery. Today we're here to talk about our bariatric surgical options. We've had the need to call upon them because there's an increasing epidemic of overweight individuals that are suffering from the other diseases that come along with being overweight. There's a certain point where your BMI, which is a height-weight index, reaches a point that other conditions such as diabetes, heart disease, arthritis start to increase because of the increase in weight. We know that dieting and exercise is not an easy task for many, and that often doesn't do the trick. And so these bariatric options have now been realized by the entire medical community as necessary to maintain health. The goal is so that the comorbid conditions improve with the weight loss. It's not considered a cosmetic operation. And basically there are two kinds, along with lifestyle change, diet and exercise, calorie counting, etc., that I offer because of their risk-safety profile. The first being the lap band, which I consider the least invasive and least altering. It's adjustable. It's a belt basically that goes around the top of the stomach and makes you feel full quicker and longer, and helps with restrictions so you can't eat too much too fast. That has good success with little risk and a short recovery. The goal is to lose about 2/3 of your excess weight at about 5 years. 40% at 1 and 50% at 2. Keeping those realistic goals with the reinforcement and the follow-up and adjusting the band along with the diet and exercise helps you lose the weight and undo your diseases and get rid of a lot of your oral medications. Once the band's let down or removed, it's no alteration. There's no change in physiology, so there's very few nutritional problems, side effects, etc. The sleeve is where we remove about 2/3 of your stomach and create a thinner stomach, more like a banana shape. And having this thin banana-like shaped stomach allows for the restriction and the early satiety, meaning you get full faster and stay full longer. This surgery is a little bit more complicated and a little more altering, less reversible, and has a little bit more success though, especially with diabetes. One of its drawbacks is that reflux may be a problem afterwards. The band actually takes care of reflux in the majority of patients. The sleeve, we usually keep you in a couple of nights in the hospital, and the recovery is a little bit longer because you do have a harder adjustment, needing to learn how to eat and get the appropriate calories in and avoid dehydration. Its success is a little bit greater than 2/3, or at least 2/3, maybe 5 or 10% a plus in success. It does have a few side effects for nutrition, and so that needs to be watched a little bit more diligently. The third surgery, which I don't particularly offer, is the gastric bypass, because I thought and felt, and still do, that surgery is a little bit more radical and comes with a lot more side effects and problems. And it's really the last step that's hard to rebound or recoup or have an exit strategy should that fail. And that still has about a 25 to 30% failure rate. That has more nutritional problems, problems with leaks and bowel obstructions, because not only does it remove most of the stomach, leaving a little pouch, but it also bypasses a good portion of the small intestine, so you don't digest well, you don't absorb well. The goal is to help with diet and exercise to reduce the weight, to a point where your comorbidities start to improve, quality of life comes along with that, and as you begin to feel better, and do more, and look better, that's all gravy, so to speak. The weight itself, watching the numbers drop, does happen, but what's more importantly, a sign of success is the other diseases improving and quality of life improving. Realistic goals, therefore, in the follow-up and discussions with our team and the bariatric center personnel is important to keep the behavior modification that goes along with the change in lifestyle and eating to help you adjust and adapt with these changes, which are many. Is why we feel that our bariatric center is successful, and most of our patients feel that way as well. We have dietitians, support groups, a lot of personnel to refer to for educational advice, and they can refer you on to various websites, help with insurance questions, which we're also very astute in dealing with. The way this process usually begins, a referral is made by either your primary, or you've investigated it and you may want to come to a seminar or call directly for an office appointment. Once in the system, we can advocate and look at your insurance plan, figure out what the requirements are in that regard, see you as a patient and decide if you need certain consultations prior to the surgeries. The surgeries being different have different requirements going in regarding clearance from other physicians, especially if you have significant comorbidities. And after we look at your insurance requirements, we begin the educational process. Then you can decide on the procedure and move ahead. Our staff will help you with the steps necessary. There is peri-procedural dieting outside of the usual calorie counting and the carbohydrate addiction model to follow, meaning low carbs, high protein. That's going to be the basic mantra for life, but peri-procedurally, before the surgeries, there is a liver shrinking diet, and we'll review that with you. After the surgery, there's a progression of liquids to solids over a few weeks. Adjustments done for lap bands in the office when we make those tighter or looser as need be. Also has a 3-day progression of liquids to solids if the band is snugged up. Recovery is a little bit different for the two procedures, as I touched on before. We usually can send the lap band patients home the same day. They feel pretty good in a week. It's equivalent to surgery such as a laparoscopic cholecystectomy, gallbladder removal, and they feel pretty good at the outset and have the get up and go. The sleeve procedure is a little bit longer in the hospital stay, 1 to 2 days. They usually feel good in a week to 2, but the get up and go may be a 3 to 4 week process regarding adapting to the food and liquid requirements in order to maintain hydration. Well, thank you very much for taking the time to inquire, and I hope that you'll be successful in your endeavors. Please reach us through the website or various phone numbers to get the process started. We'll be glad to help you. Thanks for listening, and see you soon.